Hello everyone. So in this small short module, we shall be talking about adolescent development. Now, what are the biochemical changes which occur in adolescence? There are two important things which are mentioned in Nelson and you need to know. The first thing is that the maturation of gonadotropin releasing hormone, that is GnRH pulse generator, is among the earliest neuroendocrine changes associated with the onset of puberty. GnRH axis gets activated, due to which FSH and LH secretion initially occurs in a pulsatile manner. Later on it turns into almost consistent secretion with peaks occurring and troughs occurring at certain times of the day. So this is the neural axis which is initially activated before the somatic and genetic changes they become apparent. So the first thing is GnRH pulse generator. Then you need to remember that adrenal production of androgens, they occur quite early as compared to the genital or the testicular production of androgens. So the androgen which is produced is DHEAS. It begins to form as early as 6 years of age, and sometimes it may be associated with underarm odor, and these genital hair are called as adrenarche. Adrenarche are not present consistently, they are often absent, and they are not categorized as a part of the pubertal development. However, adrenarche is one of the earliest signs which can precede the onset of puberty proper. What is puberty proper? There is no such thing as puberty proper. It is a layman's term which we use to indicate when there is onset of genitopubic hair and the changes occurring in breast in case of females and testis and penis in case of males. So after these biochemical changes, we initially come to, let's first talk about females. In females, what is the sequence of pubertal development? Now the onset of puberty tends to follow a very specific pattern. Initially, there is onset of thylarche, then you have pubarche, and finally you have menarche. When you had prepared for your NEET PG exams, then you had read only about the sequence, maybe a few one-liners, and then SMR staging, and that would be through it. But when you are preparing for super specialty, you need to go a lot into details, and that is where we will be going into. So thylarche refers to the development of breast, that is breast bud development. So this you already know, so I'm not writing the name. Pubarche refers to the appearance of pubic hair, and menarche refers to the onset of menses. The timing of onset of puberty varies across various individuals. However, the relative gap after which each sequence is happening is relatively fixed. It is usually seen, Nelson says, that thylarche, that is onset of pubertal development, can occur anywhere between 7 to 12 years of age. So there is a long range. It can happen anytime between 7 to 12 years. However, once it begins, menarche will always come 3 years after onset of thylarche. Always does not mean ki there cannot be one day more or one day less, but in general, when studies are done, it is found that it is a consistent time period which is followed from thylarche all the way through pubarche to menarche, and that period is usually around 3 years. So after this, there are 2 or 3 things that you need to know. This is thylarche is called as the first visible sign of puberty. This is the first visible sign of puberty. And then you have the growth spurt or the increase in the height spurt. Height spurt or peak growth spurt occurs between pubarche and menarche. So this is the time during which peak growth spurt is seen. Another controversy. You may have some growth spurt coming even before thylarche, but it is often missed and it is not considered to be the visible sign of puberty. So some growth spurt can start before thylarche also, but if the MCQ says what is the first visible sign of puberty, this is MCQ not only asked in NEET PG, it has been asked in super specialty also. So that will be thylarche, then pubarche. Where does the peak growth spurt occurs? Peak growth spurt occurs between pubarche and menarche. Now another important thing that you need to understand, and Nelson has talked about it. It is generally seen that the onset of puberty or the onset of thelarche is dependent upon many factors. It is dependent upon genetic factors, it is dependent upon environmental factors, it is dependent upon the weight and nutrition status. Certain girls in the same family tend to have a slightly earlier onset of puberty, and certain girls in the same family have a tendency of showing late onset of puberty. So there is a genetic component of that. And of course, if there is obesity, in case there is increased estrogen production, the onset will occur a bit early. In case of malnutrition, in case of anemias, you may have slightly delayed onset of puberty. So all these factors are known to happen. World over, studies have shown that now thelarche is occurring earlier as compared to women, say 30 years or 40 years back. If you ask in the same family, you will find that the grandmother had slightly delayed onset of puberty. There are exceptions, but the grandmother had delayed onset of puberty. Mother had slightly earlier as compared to her mother, and the girl herself, as compared to her grandmother, would have onset of puberty much earlier. This phenomena is worldwide. There are many theories for that. One of the theory indicates the role of obesity. Another theory indicates that there is a role of synthetic estrogens present as pollutants and present as preservatives in the foods that we consume. All these are theories, nothing of them have been proven, but these are the points that you need to remember. Now moving to sexual maturity rating or SMR staging in females. What is the SMR staging in females that you need to remember? Stage 1, you have no pubic hair. So two parameters are used here, pubic hair and breast development. So no pubic hair or pre-adolescent is stage 1. Breast is also pre-adolescent. What is stage 2? Stage 2, the pubic hair will be sparse, they will be straight and lightly pigmented and mainly present on the medial border of labia, not on the thighs, labial medial border. And breast and papilla will form a small mound with areola diameter being increased. Breast development will occur earlier as compared to pubic hair development by a few months. Then you have stage 3. In stage 3, the pubic hair become darker, they increase in amount and begin to curl. So initially they were like straight, now they begin to curl. So this curling begins in stage 3. And the breast and areola further enlarge, there is no contour separation, everything is part of the same level. Then stage 4. In stage 4, the pubic hair become coarse, curly and abundant. They are just like adult, but they are not present on the medial thigh. This is important, because the only thing which distinguishes 4 and 5 SMR in pubic hair is medial thigh, whether the medial thigh has hair or not. If medial thigh has no hair, stage 4. If it is present, it is stage 5. And then stage 4, the key word, potential MCQ. What is the stage during which secondary mound forms? Here, areola and papilla tend to form a secondary mound over the remaining part of breast. So if the remaining part of breast is like this, they will form a secondary mound like this. So this is secondary mound formation. And finally, we have stage 5, where adult-like hair are present and they are also present on the medial thigh. Adult breast, the nipple projects, but areola comes back to form the general breast contour. So stage 4, it is projecting up. Stage 5, it settles down. Only the nipple is remained, which is projecting upwards. So this, if I have to show it like this, stage 4, it will be something like this. This is the chest, this is the breast, this is your areola, and this is nipple. So this areola and nipple is projecting, both of them are forming a secondary mound over this like this. So this colored form, I'll show it in yellow. So this colored form is your areola and nipple. Whereas in case of stage 5, you will have the breast tissue and the nipple. And the areola is now forming a part of the contour of the breast only. So this is the difference and the importance of secondary mound. Now moving to the pubertal changes which occur in case of males. In case of males, the first visible sign in female was breast development or thelarche. In males, the first visible sign of puberty is testicular enlargement. So testicular enlargement is considered to be the first visible sign of puberty in males. Testicular enlargement is followed by the onset of pubic hair. Usually pubic hair appears around 6 to 8 months after the testicular enlargement begins. Testicular enlargement and scrotal enlargement tend to go hand in hand, and both of them are considered under the same heading as we will see later. And after pubic hair development, you have onset of penile development or penile enlargement. So penile development, because length and breadth both are increasing, so it is sometimes called as penile development. So this is the sequence which is followed in case of males. Now in case of males, you need to understand that the peak growth velocity or peak growth spurt, cannot be as easily predicted as you can predict in case of females, that it is occurring just a few months before menarche. Peak growth spurt in males is greater compared to females, but comes approximately 6 months to 2.5 years later than female of same age. It is greater, but the amount comes later, and so that is why for the same age, particularly in 8th or 9th standard or 9th or 10th standard, you will find males and females to be of the same height, and sometimes females becoming taller earlier as compared to males. But if you look at the +1, +2 kind of classes, you will have the majority of the males being taller than females, and this is because the growth spurt is greater, but it comes later, and it is better defined according to SMR stage as compared to the development stage as we did in case of females. So let us talk about something regarding the SMR staging in males. So again, in case of males, we will take SMR stage 1 to 5. The difference being pubic hair will be there, it will be very similar to that of females, but instead of breast, we will talk about penis separately and testis separately. So first one, stage 1, pubic hair are none, penis is pre-adolescent and testes are pre-adolescent. Stage 2, pubic hair similar to that of females, sparse, long, straight, lightly pigmented hair. Penis shows minimal or no enlargement, but testis is enlarged, and testis is enlarged, so scrotum is enlarged. The scrotum is pink in color. This is very, very important. Pink scrotum is a feature of which condition can be a one-liner to you. And altered texture is seen. Initially, if you look at young kids, pre-adolescent kids, the scrotum is smoother. In case of stage 2, once it becomes pink, puberty begins, the testis enlarge and the scrotum, rugosities or folds tend to start appearing on that. Then you have SMR stage 3. The hair are darker, increase in amount and begin to curl, just like that of females. Penis length increases earlier compared to breadth, so lengthens in stage 3, and volume and size of testis will increase here. Stage 4, the hair become curly, except they are not present on the medial thigh, just like we did for females. Penis, important thing, potential MCQ, breadth will increase, it will become broader in size, and the glans penis will increase in size. So question may ask you, what is the stage during which glans development happens? Initially, glans penis is not in the form of a bulbar apparatus, it is less well defined. Well definition of glans penis tends to occur in stage 4 and can be a potential MCQ. Another important point is, in case of testes, the testes will enlarge further, but dark or pigmented scrotum will appear. So pink scrotum stage 2, dark scrotum stage 4. And length increase of penis stage 3, length continues to increase but more increase in breadth stage 4, glans penis development stage 4. And finally, you have stage 5 where adult-like hair are present, including medial thigh, penis is adult size and testes are adult size. So key words are important. Now moving to the sexual development in boys and girls as shown diagrammatically. These are the graphs taken from American Academy of Pediatrics review article. If you see carefully, let's look at the boys first. The peak growth velocity. When is the peak growth velocity coming? So in boys, if you see this graph, peak growth velocity comes between SMR stage 3 and 4. So it comes between stage 3 and stage 4 SMR. And what is the peak growth velocity? Nelson has given the value. It is around 9 to 10.5 centimeter. 9 to 10 it is mentioned. 9 to 10.5 is the one which has been recently updated in two of the latest journals. So 9 to 10.5 in case of boys. It is coming a bit late. And when is spermake coming? What is spermake? Onset of sperm formation. And when they are clinically detectable, spermake is occurring at, you can write or at the top, spermake is happening somewhere around SMR stage 4. This is the time during which spermake begins. Sexual development in case of girls, peak growth velocity. This is the peak growth velocity which is occurring between stage 2 and 3. This is mentioned in Nelson also. In case of girls, the peak growth velocity will occur between SMR stages 2 and 3. Between SMR 2 and 3, and the peak growth velocity is between 8 to 9 centimeters. So it occurs early, but it is less as compared to males. Now there is a point which is mentioned in Nelson. Nelson says in the text that sperms can be detectable as early as SMR stage 3. However, this line is very controversial. If you look at most of the textbooks and if you look at most of the endocrinology review articles also, they all mention that spermake tends to begin between SMR stage 3 and SMR stage 4. So the point that can be seen is not the same as mostly seen. Most of the children, including the Indian population, you need to understand that in Western countries, the onset of pubertal development is a bit earlier as compared to our setting. That is how our genetic makeup is. In case of Indian setting, it has been clearly shown in studies that SMR stage 3 and beyond is the time during which spermake happens. And the American Academy of Pediatrics chart also shows the same. So it is a controversial point. You will come across many controversial points. So, but if the question is asking very specifically, sperm in urine can be detected in males as early as what age? They can be detected as early as SMR stage 3. But normally what is the time of appearance? It is between 3 and 4. Not at 3 but beyond 3. So these are controversial areas. The more you read, the more you come across such controversies. Now moving over to another graph. This graph is showing what I have already told you. In females, the peak growth velocity comes earlier as compared to males, but it is lesser as compared to males. Now exam oriented point. An 11-year-old boy presented with complaints of bilateral breast enlargement since past few weeks. What is the next step in management? Bilateral breast enlargement, which is usually non-tender but maybe slightly tender, is very common in pubertal boys. It is also called as pubertal gynecomastia. The word gynecomastia is now no longer favored by some authorities because they say it is not a pathological condition. But physiological gynecomastia, that is pubertal gynecomastia, is pretty normal and nothing needs to be done. Wait and watch is usually undertaken for these patients unless you have something pathological, something abnormal other than this happening in the child. So just only this, nothing needs to be done. Now, what is the somatic growth pattern in case of adolescents? The somatic growth pattern in adolescents, it shows a pattern which is called as distal to proximal. Distal to proximal. What is distal to proximal? Once the somatic growth begins, the fingers will enlarge first, then the palm. So that is, the hand will enlarge first, then your forearm, then your arm, and then the trunk, neck, and the proximal part of your girdle. So this distal to proximal progression may sometimes produce bizarre looking body image of adolescents, and they may have problems when they compare their figures or their photographs to those of the adults. If you go back into your own Facebook timeline and you come across your own old pictures, you will find that many of your pictures are not that great. Nobody likes their old pictures. I don't like them certainly. One thing you will notice is that you had a very aberrant kind of a body proportion. Long arms, long legs, and relatively small trunk. That is normal. That is the somatic growth pattern because the growth pattern in adolescents is distal to proximal. Then an interesting fact. Skeletal growth always precedes the muscular growth, and that is why sprains and strains are common in case of adolescents. They are playing around, the bone has increased, the joints have become larger, but the supporting muscle mass, the ligaments, the tendons which are keeping them in place, they are not yet properly developed. They are relatively less, and so there will be a tendency for dislocation and sprains to happen. Other physiological changes in adolescence which can happen. First is changes in the lean body mass and fat deposition. In case of males, there is increase in the lean body mass. Whereas in case of females, there is increased fat deposition, particularly around the thighs and the buttock region. Changes in the cardiovascular system, they occur in both sexes, more in case of male as compared to female. There is increase in the heart size, there is increase in the blood pressure, there is increase in the heart rate. Changes in the lungs occur in both genders, male and female. Vital capacity is increased, and so it increases the aerobic capacity of the child. Changes in the eyes. Elongation of the globe can happen. And because of elongation of the globe, this is the time during which myopia comes into play. I can relate to it personally. When I had just entered my 10th standard, I developed myopia at that time. I did not realize it at that point. Now I am able to do it because I now read Nelson. And Nelson clearly says, if you look at the incidence of myopia, there is a peak which occurs corresponding with the onset of pubertal development. That is due to elongation of globe in puberty. Does not happen in everyone, but it is fairly common. Then changes in the pharynx and larynx, they are much more in case of males as compared to females. There is elongation of pharynx, larynx and the supporting ligaments, and so there is hoarseness of the voice, the so-called voice cracking which tends to develop in males. Changes in the glandular system, again it is more prominent in case of males as compared to females. There is increased secretion of sebaceous glands and there is increased secretion of apocrine glands. So problems of body odor may appear during this time. So that is why we advise proper hygiene, and we advise the use of deodorants and keeping the hair to the short in the axillary area and pubic area in case these problems are more troublesome. And changes in the calcium deposition, Nelson says 50 to 65% of the total calcium in the human body is laid down during puberty. So this is another thing that you need to remember.